Assalamu alaikum. Dear my professors and my colleagues, I will discuss today with you a presentation about COVID-19 related optic neuritis. Optic neuritis is defined as inflammation of the optic nerve, which is mostly idiopathic. However, it can be associated with variable causes like demyelinating lesions, autoimmune disorders, infectious and inflammatory conditions. MS, multiple sclerosis, is the most common cause of demyelinating optic neuritis. The pathogenesis of optic neuritis is not well understood. It is likely due to some inflammatory process which leads to delayed type 4 hypersensitivity reaction induced by released cytokines and other inflammatory mediators from activated peripheral T cells, which can cross the blood-brain barrier and cause destruction of myelin, neural cell death, and axonal degeneration. The types of optic neuritis: it is either retrobulbar neuritis, it's about 2/3 of cases with normal optic disc appearance. Number 2, papillitis with a swollen disc. Perineuritis, which involves the optic nerve sheath while the optic disc may or may not be swollen. Neuroretinitis with optic disc edema and macular star exudation. The retrobulbar neuritis and papillitis are mainly associated with MS, while perineuritis and neuroretinitis are more often associated with infectious or inflammatory pathologies. Based on its clinical features, optic neuritis can be classified as atypical picture or typical picture, which is present without any manifestation of systemic disease and may occur either as a clinically isolated syndrome or in association with multiple sclerosis. The triad or the classic triad of optic neuritis usually present in all cases, starting from the visual loss, periocular pain, and dyschromatopsia. What other signs of optic neuritis? We said that it is either typical form or atypical form. So what are the features of typical optic neuritis in adults? Number 1, it is acute or subacute onset, promoting over several hours to 2 weeks. Young adult patients with peak manifestation between 15 and 50 years of age, and it occurs in females more than males. The periocular pain in 90% of cases, especially with eye movement. Unilateral loss of visual acuity, variable in severity from 20/20 in 10.5% to no light perception in 3.1%. Or maybe bilateral, usually in children, often associated with a post or para-infectious demyelination. Number 6, from the features of typical optic neuritis, it is reduced contrast sensitivity. Another phenomenon, which is exercise or heat-induced deterioration of visual symptoms or misperception of the direction of movement of an object. Number 9, ipsilateral relative afferent pupillary defect. Lack of the defect suggests a pre-existing or concurrent optic neuropathy in the fellow eye. Number 10, normal or swollen optic disc head, and it is more common in children. Number 11, possibility of mild uveitis and retinal periphlebitis. Visual field defect, which may be any type, ranging from commonly seen diffuse depression and central or centrocecal scotoma to rarely seen quadrantic and altitudinal defects. Also, spontaneous visual improvement in more than 90% of patients. No deterioration of vision after steroid stoppage. Pallor of the optic disc head. Previous history of optic neuritis or MS attack. Reduction in vision in bright light. Phosphins or photopsias. Spontaneous flashes of light provoked by eye movement. So the phosphins or photopsias provoked by eye movement. And finally, dyschromatopsia, which may be any type. Various forms of optic neuropathy mimic optic neuritis, resulting in misdiagnosis, which may include the anterior ischemic optic neuritis, Leber's hereditary optic neuropathy, which most closely resemble optic neuritis. Also, we should differentiate the optic neuritis from the toxic and metabolic causes and from the compressive optic neuropathies. The anterior ischemic optic neuropathy, which occurs in individuals over 50 years of age and equally in males and females, is characterized by unilateral, sudden, painless drop of vision. The pain is present in less than 10% of patients, accompanied by headache in patients with temporal arthritis. So it is unilateral, sudden, painless drop of vision, varying from visual acuity of better than 6/6 to no perception of light with impairment of color vision and altitudinal visual field defect. Also in the ion, crowded optic disc appears swollen with sectorial hemorrhage and small or no cup. Most patients with ischemic optic neuropathy have hypertension, hypercholesterolemia, diabetes mellitus, obstructive sleep apnea, or other vascular risk factors. Anterior ischemic optic neuropathy has two major subtypes. Non-arthritic anterior ischemic optic neuropathy is the most common form. The visual loss in this subtype is considered to be as a result of insufficient blood supply to the optic nerve head, and optic neuritis has a better prognosis than this type of ion. The second type from the ischemic optic neuropathy, it is the arthritic type, is more common in females, starting with massive loss of vision, usually due to giant cell arthritis, and has a significant relationship with polymyalgia rheumatica. Patients may have jaw claudication, proximal myalgia and arthralgia, scalp tenderness, headache, fatigue, and significantly increased erythrocyte sedimentation rate and C-reactive protein level. Amaurosis fugax is a threatening sign of impending arthritic anterior ischemic optic neuropathy. As compared to non-arthritic type, the vision loss is more severe and the optic disc is pale. Temporal artery biopsy is the gold standard for diagnosis of anterior ischemic optic neuropathy arthritic type. Now, COVID-19. COVID-19 infection and its neurological complications. An unexpected infection caused by a coronavirus is devastating the health of the world population and consequently the global economy. Although the primary manifestation of COVID-19 infection is pneumonia, there is increasing evidence that suggests the spread to key organs other than the respiratory system, among them the central and the peripheral nervous system. A growing body of evidence shows that neurotropism is one common feature of coronaviruses. How can coronavirus of the nervous system can be due to a direct action of these viruses on the nervous tissue, and or to an indirect action through the activation of immune mediated mechanisms. While the first action can be verified during the acute phase of the disease, the second can be apparent only after days, weeks, or even months following the acute phase. COVID-19 and optic neuritis. From the reported cases of optic neuritis in the literature and from our practice, we can classify the COVID-19 related optic neuritis into two main categories. Number one, early optic neuritis, which occurred simultaneously with the active symptoms of coronavirus disease, and the other type, it is a delayed optic neuritis, occurred days, weeks, or even months following the acute phase. The early type, the early optic neuritis with COVID-19, its pathogenesis when the infection with coronavirus leads to disturbances in endothelial cells that are followed by intense thrombin generation as opposed to reduced fibrinolysis, which leads to a hypercoagulable state. Thus, COVID-19 comprises a severe inflammatory response with a state of hypercoagulability, ischemia, and hypoxemia. This is the first possibility to the early optic neuritis with COVID-19, or direct action of these viruses on the nervous tissue of the optic nerve. So, in this pathogenesis, we have two ways: either ischemic optic neuritis during the acute attack of coronavirus disease, or inflammatory type of optic neuritis during the acute phase of the coronavirus disease. So the ischemic optic neuropathies are some of the main causes of blindness or seriously impaired vision in middle-aged patients, when the anterior location and the non-arthritic etiology. Optic neuropathy is usually related to nerve hypoperfusion or the presence of microemboli in the arteries or arterioles that supply this structure. Embolization of the arteries that supply the optic nerve is a rare cause of non-arthritic anterior ischemic optic neuropathy, but which believed to be triggered by that state of hypercoagulability of COVID-19. So the early optic neuritis, it may be ischemic or it may be inflammatory. But in delayed optic neuritis occurred days, weeks, or even months following the acute phase, COVID-19 virus has triggered the immune system to present these findings. So the delayed type, it is immune mediated type. It is believed that the demyelination optic neuritis is immune mediated, but the exact targeted antigens remain unknown. Systemic T-cell activation is identified at symptom onset and precedes the changes in the CSF. T-cell activation leads to the release of cytokines and other inflammatory agents. B cell activation against the myelin basic protein is not seen in peripheral blood but can be demonstrated in the CSF of patients with optic neuritis. This one of the case reports present in the literature, bilateral optic neuritis with COVID-19, and this is the MRI of this patient showing the slightly ill-defined appearance of the optic nerve. This is another case report showing the effect of the COVID-19 on neurological system. Another case report of COVID-19 related optic neuritis, and this is the MRI showing here in the left eye hyper signal which corresponding to the neuritis. And it is another case from our practice. It is a male patient, 45 years old, no systemic disease previously, presented with right eye decrease of vision 0.5 after 3 weeks from starting the acute phase of the coronavirus infection, preceded with right ocular pain and disc chromatopsia. This is the fluorescein angiography of this case showing the temporal pallor of the right eye of the optic disc head. This is the left eye. So with COVID-19 related optic neuritis, what is the treatment? The early ischemic type of optic neuritis, treatment with solumedrol methylprednisolone at a dose of 1 gram per day for 5 days was started with gradual withdrawal, obtaining partial recovery of the condition due to ischemic nature of the condition. Anticoagulants may play a role in limitation of the condition. But in delayed type of optic neuritis, which is the immune mediated type, has a good prognosis with systemic steroids due to its pathogenesis. So what are the points of interest? However, studies related to the pathophysiological mechanisms involved in this process are essential to establish the causal relationship between these all clinical entities. Furthermore, given that the most accessible part of the central nervous system it is the optic nerve, so optic neuritis represents an important point in order to clarify the mechanisms through which the virus leads to neurological injuries. COVID-19 virus infection is causing a huge impact in the world as pandemic. Its extent as clinical disease is still poorly understood and explained. Therefore, we share this interesting presentation to you to add to the vast ways in which COVID-19 infection can present. And thank you.